We supply our kids with the latest and safest gear when playing sports. But how protected are they from cancer when they compete?
And in Alabama, it's about 86,000 or so adolescent athletes participate in organized sports. Many of them participate in their practice and their competition during the afternoon hours when the UV exposure is the highest.
Sun exposure during peak hours can lead to skin cancer. Some cancers may advance to melanoma, which can be fatal. UAB professor Brian Geiger is looking at how Alabama schools, teachers, and coaches supply information to students about skin cancer and other cancers.
So the next thing that we did is we looked at the state-approved instructional resources, that is the textbooks for health classes they can use their state dollars for. And we audited those, if you will, or used specific descriptors about skin cancer and 5 other cancers, including lung and breast and cervical cancer, to see how much exposure there is in the state-approved books if they are to use those. And we're discouraged that even the best books that had the most content was still less than 1% of the coverage for all 6 cancers combined.
In addition to looking at classroom materials, Dr. Geiger's team will survey teachers and coaches about how much time athletes spend outside during peak sunlight hours and how often they encourage students to use sunscreen.
Cancer education in the secondary grades, both within public and private schools, is important because we believe children need to learn preventive health behaviors.
Researchers realize it's impossible for teachers to cover every single health topic in a semester, but the hope is to provide guidance for instructional resources.
We would love to be able to say that by providing more contact hours of instruction or teaching a defined number of skills, then you ultimately will cause a decrease in cancer by a measurable amount, but the science isn't there to support that yet. But we do hope that by providing knowledge and some skills training and some encouragement to practice risk reduction, that ultimately it will have an effect in protecting those individuals and reduce the risk of cancer.